नमस्कार दोस्तों। आज के वीडियो में हम लोग पढ़ने जा रहे हैं क्लिनिकल साइकोलॉजी और साइकेट्री का एक ऐसा पार्ट जिसको हम लोग जानते हैं पर्सनैलिटी डिसऑर्डर्स के नाम से। पर्सनैलिटी डिसऑर्डर्स के बारे में आज हम लोग उनके टाइप्स को पूरा ओवरव्यू करेंगे, सिम्टम्स को देखेंगे, उनके इटियोलॉजी यानी कि कारण को देखेंगे और एविडेंस बेस्ड ट्रीटमेंट, मतलब ऐसा ट्रीटमेंट जिसका सबूत है, जिसका प्रामाणिकता है, जो काफ़ी ज़्यादा रिलायबिलिटी वैलिडिटी के साथ आता है, तो वैसे ट्रीटमेंट्स को भी देखेंगे। तो चलिए आगे बढ़ते हैं और ये जानते हैं कि पर्सनैलिटी डिसऑर्डर क्या होता है। तो सबसे पहले दोस्तों कि व्हाट इज अ पर्सनैलिटी डिसऑर्डर। ए पर्सनैलिटी डिसऑर्डर इज अ डीपली इनग्रेन्ड, inflexible and enduring pattern of inner experience and behavior that deviates significantly from cultural expectation। यानी कि पर्सनैलिटी डिसऑर्डर जो होता है एक डीपली इनग्रेन्ड, इनफ्लेक्सिबल एंड इंड्यूरिंग पैटर्न ऑफ इनर एक्सपीरियंस, हमारे आंतरिक अनुभव का एक ऐसा पैटर्न होता है जो कि बहुत ही ज़्यादा हमारे कल्चरल एक्सपेक्टेशन से डिविएट कर जाता है, मतलब बहुत अलग होता है। जैसा हमारा कल्चर हमको बिहेव करने का, मेरा पर्सनैलिटी रखने का एक्सपेक्टेशन करता है, वैसा बिल्कुल नहीं होता है। इसका DSM-5 का डायग्नोस्टिक क्राइटेरिया क्या है? DSM-5 यानी कि डायग्नोस्टिक एंड स्टैटिस्टिकल मैनुअल 5 में किस तरह के कौन सा क्राइटेरिया अगर मीट हो जाए, कौन सा क्राइटेरिया अगर मिल जाए, तो उसको हम लोग पर्सनैलिटी डिसऑर्डर के रूप में आइडेंटिफाई या कैटेगराइज कर सकते हैं। तो सबसे पहला बात है कि मैनिफेस्ट अक्रॉस 2 और मोर की डोमेन्स। पहला कॉग्निशन और दूसरा अफेक्टिविटी, तीसरा इंटरपर्सनल फंक्शनिंग एंड चौथा है इम्पल्स कंट्रोल। अगर इस तरह कॉग्निशन में, अफेक्टिविटी में, इंटरपर्सनल फंक्शनिंग में और इम्पल्स कंट्रोल में अगर दिक्कत आ रही है, अगर इस सारी चीज़ में एबनॉर्मल बिहेवियर आ रहा है, तो वहाँ पे हम लोग उसको बोल सकते हैं कि पर्सनैलिटी डिसऑर्डर हो गया। कॉग्निटिव मतलब वो खुद के और दूसरों के बारे में नहीं सोच पा रहा है, दूसरे के थॉट को परसीव नहीं कर पा रहा है, दूसरा क्या फील कर रहा है वो नहीं पता कर पा रहा है। दूसरा अफेक्टिविटी, इमोशनल रिस्पॉन्स, वो सामने वाले के इमोशनल रिस्पॉन्स को या खुद के इमोशनल रिस्पॉन्स को नहीं जान पा रहा है। तीसरा है इंटरपर्सनल फंक्शनिंग, यानी कि वो उनका जो रिलेशनशिप होता है अपने परिवार के साथ या फिर जिनको भी उन सराउंडिंग है उनका, तो उनके साथ उसका रिलेशनशिप बहुत खराब हो जाता है, जिन किसी भी व्यक्ति को पर्सनैलिटी डिसऑर्डर होता है। और चौथा इम्पल्स कंट्रोल। कुछ पर्सनैलिटी डिसऑर्डर ऐसे होते हैं दोस्तों जहाँ पे इम्पल्स कंट्रोल करना बहुत ही मुश्किल हो जाता है। टिपिकली हैज एन ऑनसेट इन एडोलसेंस और अर्ली एडल्टहुड। जो पर्सनैलिटी डिसऑर्डर का ऑनसेट होता है वो या तो एडोलसेंस में या अर्ली एडल्टहुड में ही हो जाता है एंड रिमेन्स स्टेबल ओवर टाइम, और बहुत ही लंबे समय के लिए ये स्टेबल रहता है एंड लीड्स टू सिग्निफिकेंस डिस्ट्रेस और इम्पेयरमेंट, और इसके का वजह से बहुत ही गहरा डिस्ट्रेस और इम्पेयरमेंट होता है। अब हम लोग पढ़ते हैं क्लासिफिकेशन ऑफ पर्सनैलिटी डिसऑर्डर। दोस्तों पर्सनैलिटी डिसऑर्डर को मेनली 3 कैटेगरी में यानी कि 3 क्लस्टर्स में बांटा गया है। पहला क्लस्टर का नाम है क्लस्टर ए, दूसरा क्लस्टर बी और तीसरा क्लस्टर सी। तो क्लस्टर ए का जो मेनली नाम है वो है ऑड एंड इसेंट्रिक, यानी कि क्लस्टर ए के पर्सनैलिटी डिसऑर्डर जो होते हैं वो ऑड और इसेंट्रिक होते हैं। जैसे कि इसको कैरेक्टराइज किया जाता है बाय अनकन्वेंशनल थिंकिंग, सोशल विड्रॉल एंड सस्पिशियसनेस। क्लस्टर ए में जितने भी पर्सनैलिटी डिसऑर्डर आते हैं तो उनमें कुछ कॉमन कैरेक्टरिस्टिक्स होता है, जो कि पहला होता है अनकन्वेंशनल थिंकिंग। वो कन्वेंशनल तरीके से नहीं सोचता है, काफ़ी उनका थिंकिंग जो होता है वो बहुत ही ज़्यादा अनकन्वेंशनल होता है। दूसरा है सोशल विथड्रॉल, वो सोसाइटी से इंटरेक्ट नहीं कर पाता है, समाज से सोशल आइसोलेशन में चले जाता है। और सस्पिशियसनेस, उसका पर्सनैलिटी हमेशा सस्पिशियसनेस रहेगा, या तो वो खुद पे शक करेगा या सामने वाले पे शक करेगा। तो क्लस्टर ए में मेनली 3 पर्सनैलिटी डिसऑर्डर आते हैं। पहला है पैरानॉइड, दूसरा है स्किज़ॉइड एंड तीसरा है स्किज़ोटिपल। अब आते हैं दोस्तों क्लस्टर बी पर। क्लस्टर बी जिसको मेनली ड्रामेटिक एंड इमोशनल कह के कैटेगराइज किया जाता है, और इसके अंदर जो होता है दोस्तों वो बहुत ही खतरनाक होता है, क्योंकि सबसे मेजर पर्सनैलिटी डिसऑर्डर, सबसे खतरनाक, सबसे डिस्ट्रेसिंग, सबसे जो इम्पेयरमेंट पैदा करता है पर्सनैलिटी डिसऑर्डर वो होता है क्लस्टर बी का, जिसमें आप इंटेंस इमोशनल वोलेटिलिटी देखेंगे, इम्पल्सिविटी देखेंगे और रिलेशनल कन्फ्लिक्ट देखेंगे। इसमें ऐसा बिहेवियर करता है, या तो व्यक्ति खुद को चोट पहुंचा देता है या दूसरे को पहुंचा देता है। तो क्लस्टर बी में मेनली कितने पर्सनैलिटी आते हैं? पहला है एंटी सोशल, दूसरा है बॉर्डर लाइन और तीसरा है हिस्ट्रोनिक और चौथा है नार्सिसिस्टिक। यहाँ पे 4 पर्सनैलिटी डिसऑर्डर आते हैं, 4 क्लस्टर बी में आ गया और 3 जो है क्लस्टर ए में आ गया। अब आते हैं क्लस्टर सी पे। क्लस्टर सी को मेनली एंग्शियस और फियरफुल पर्सनैलिटी टाइप्स के माध्यम से, पर्सनैलिटी डिसऑर्डर के माध्यम से कैटेगराइज किया जाता है और इसको डिफाइन किया जाता है बाय परवेसिव एंग्जाइटी, fear of rejection and excessive need for control. And this cluster C type of personality mainly includes avoidant personality disorder, dependent personality disorder and obsessive compulsive personality disorder. Let's move forward to our next topic. What is cluster A, odd and eccentric types? Let's get more deep into the cluster A personality types. The first one is paranoid and schizoid. The paranoid personality disorder characterized by pervasive mistrust and suspiciousness of others. The person who is suffering with the paranoid personality disorder may show the response like mistrust and suspiciousness of to others and interprets motives as malevolent without sufficient basis, and they interpret in their mind that your motives towards them is very malevolent, not good, and they reach to this conclusion without any sufficient basis. And the another type is schizoid personality disorder. The schizoid personality disorder is characterized by detachment from social relationship. The first one is this type of person detached from social relationship and a restricted range of emotional expression and prefers solitary activities and lacks desire for intimacy. And the second one is schizotypal. Third one is schizotypal disorder. Schizotypal personality disorder involves acute discomfort with close relationship combined with cognitive or perceptual distortions and eccentric behavior. The key symptoms of schizotypal disorder include odd beliefs or magical thinking. That today one of the example could be of magical thinking is that today I am wearing black dress, that's why it is raining. That is an example of magical thinking, friends. And the another key symptoms include unusual perceptual experiences and paranoid ideation and inappropriate or constricted affect. Let's move to the cluster B personality disorder, that is popularly known as dramatic and emotional type personality disorder. This personality disorder includes high emotion and impulsivity, and the major types are borderline, antisocial, narcissistic and histrionic. Let's dive into borderline personality disorder. The borderline personality disorder is characterized by pervasive instability in moods. The person who is suffering, who is going through the borderline personality disorder, their moods are very unstable. Their mood swing is very regular, very frequent, and interpersonal relationship is very negligible, very few, and very bad interpersonal relationship. Their self-image is also destroyed, distort, and intense fear of abandonment. They have the intense fear of abandonment. They think that the person whom I love, they will leave me, they will detach from me, and as a result the person develops the borderline personality disorder. Next cluster B personality disorder is antisocial personality disorder. Antisocial personality disorder is characterized by disregard for rights of others. They have no respect for rights of others, that others could also laugh, others could also eat, others could also smile, but when they experience the happiness of others, they get the feeling of very jealousiness. And one of the major symptoms of antisocial personality disorder is deceitfulness and impulsivity and lack of remorse. They always lack for their doing. They always lack remorse for their doing. For example, if a person who is with antisocial personality disorder, if they kill someone or if they harm someone in any way which is not acceptable according to our society, they will not have remorse for their doing, that I have done something wrong. They have not at all any remorse for any of their doings, what they have done bad according to our societal standards. And the third personality disorder is narcissistic personality disorder. The person with narcissistic personality disorder feels that they are great in their appearances. No one is handsome, no one is beautiful than them, because they feel they are the product of the god only, that no one could match their beautiful level, they no one can match their handsomest level, their personality level. And they always need for admiration. They always think that people will compliment me about my look, about my personality, about my body, that whatever I am. And they also lacking empathy. They don't feel that what the person before me is feeling. They don't have any kind of empathy also. And excessive attention seeking behaviors. The person who is dealing with narcissistic and histrionic personality disorder, they always want excessive attention, that everyone should attend me, that everyone should listen to what I am telling, and everybody should follow that what I am saying. Let's move to the cluster C personality disorder, which is popularly known as anxious and fearful types. The major personality disorder which comes under cluster C are avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. The first one we will dive into avoidant personality disorder. The avoidant personality disorder includes the symptoms like social inhibition, severe feeling of inadequacy, and extreme hypersensitivity to negative evaluation or rejection. If someone who is suffering with avoidant personality disorder, they have the hypersensitivity. Hypersensitivity matlab the sensitivity which cross the threshold of sensitivity, and they are very hypersensitive to negative evaluation or rejection. If someone rejects them for a good reason, they also interpret that I am bad, I am very bad, that's why they are rejecting me. And the major symptoms include leading to social avoidance. They are starting as a consecutive, as a result, they started avoiding social relationship, and despite a desire for connection, they have the desire that we will attach to our social connection, but they can't. The another cluster C personality type is dependent personality disorder, which includes the symptoms like pervasive excessive need to be taken care of, leading to submissive clingy behavior, and intense fear of separation and decision making vulnerability. And the last one, the 10th type of personality disorder, is obsessive compulsive personality disorder, which is shortly known as OCPD. This includes the preoccupation with orderliness. They need everything in order. They need everything arranged in order, not in here and there, not they always want perfectionism, mental and interpersonal control at the expense of flexibility, openness, and efficiency. Let's move forward with our video, which includes primary symptoms and features. We will now read about primary symptoms and features of our personality disorder, which includes, first one is emotional dysregulation. Emotional dysregulation includes rapid, intense mood shifts, inappropriate anger, outburst, and difficulty returning to an emotional baseline. And the second one is relational instability, which includes a stormy interpersonal relationship characterized by idealization and devaluation, boundary violation or isolation. And third one is impulsivity and control, that is risk-taking behaviors, self-harm gestures, substance abuse, or rigid compulsion to manage internal anxiety. Now, let's dive into etiology and causes and risk factors. The first etiology, the first cause that has been identified that could be the one cause of personality disorder is genetics and neurobiology. There is something called heritability, which the study shows that up 40 to 60% genetic vulnerability across personality disorder spectrums. If anyone is suffering from personality disorder, that it means that their ancestors, there is a high chance of personality disorder having their ancestors. And second one is brain function. When dysregulation in the prefrontal cortex and amygdala alters emotional regulation and impulse control. And third cause is temperament, inherited early childhood traits such as high reactivity, anxiety or sensation seeking. The second one is environmental factors, which includes childhood trauma, invalidating environment and socio-economic stress. The childhood trauma like physical trauma, emotional trauma or sexual abuse significantly elevates disorder risk, especially like cluster B that we have already learned. The invalidating environment, which includes chronic emotional neglect or unpredictable parenting, disrupts attachment styles. This mainly results into cluster C personality types disorder. And the socio-economic stress, the family with low socio-economic standard is more likely, is more susceptible, is more vulnerable to the personality disorders. The next one is diagnostic and assessment tools. What are the diagnostic and assessment tool through which we can identify that someone is having personality disorder? The first one is a structured clinical interview, which includes SCID-5 PD or IPDE, which comprehensive evaluation of all 10 DSM-5 personality categories. The second one is self-report inventory. We can also assess the personality disorder through self-report inventories. The self-report inventories like MMPI-3, which is popularly known as Minnesota Multiphasic Personality Inventory 3, and PID, which gives us quantifies pathological personality traits and symptoms severity. And the another way to know that someone is suffering from personality disorder is informant reports like collateral interviews, which evaluates long-term behavioral patterns outside patients' self-insight. And the last one, the last method to recognize that anyone is having personality disorder is axis 1 versus axis 2 scanning, which focuses on distinguishes personality patterns from major depression, bipolar or PTSD. Let's move forward. That is first line psychotherapy. The first line psychotherapy includes dialectical behavior therapy, DBT, which is developed for borderline personality disorder. When you will be asked in exam that through which therapy we will treat the dialectical behavior, we will treat the borderline personality disorder, then your answer will be dialectical behavior therapy, which emphasizes mindfulness, distress tolerance and emotional regulation. These are three major components of dialectical behavior therapy. What are they? They are mindfulness, distress tolerance and emotional regulation. Next one is cognitive behavioral therapy. CBT also treats the personality disorder, which targets core maladaptive schemas and cognitive distortion. CBT mainly functions that the main role of CBT is that through CBT, which can replace the person's irrational beliefs, negative beliefs into rational or positive beliefs. And the third one is mentalization based therapy and schema therapy. This therapy helps individual recognize internal mental states and reframe long-standing emotional patterns. And you can also go through comprehensive treatment plans, that which treatment, how much they contribute in treating personality disorders. And what we will Get takeaways for and summary. The personality disorder are complex but treatable condition. Early diagnosis, longitudinal psychotherapy, and compassionate clinical care are significantly improve long-term outcomes and quality of life, which mainly includes evidence-based care, reduced stigma, and multidisciplinary term. So that's all for today's lecture. We will meet in the next lecture. Till then, take care of your